So specific phobias are an intense, persistent fear or anxiety response to one specific thing. And this specific thing can really be anything, but the common specific phobias include fear of flying, fear of heights, fear of spiders or bugs, needle phobia, blood phobia, and then actually fear of vomiting is one that's very common as well. So specific phobias generally tend to look like intense anxiety when confronted with that specific stimulus. It can turn into panic. It doesn't necessarily have to, but the person with experiences specific phobia may go into a full-fledged panic attack, or they may just experience that really anxious feeling. So it could look like, again, difficulty breathing, heart rate increasing, sweaty palms, gastric distress, dizziness. And it's all around that one specific thing. So the person with specific phobia will tend to go out of their way to avoid anything that has anything to do with that feared object. So a child with a phobia of bugs may in fact avoid going outside all summer because they're afraid of encountering a bug. So it can become very pervasive in someone's life. So the treatment for specific phobia is exposure therapy. The therapist is going to work with the client on creating a list of feared situations and gradually exposing the client to these feared situations to allow them to learn to tolerate the distress. So for someone, example, with a fear of dogs or a phobia of dogs, you may start out by looking at pictures or photos of dogs and then videos of dogs. And then you may start looking at dogs from far away and generally and slowly kind of move your way up that chain to petting a dog or sitting with a dog and allowing yourself to tolerate the distress that comes along with that.